Transform Your Body Fitness. I'm a physical therapist and a fitness coach. And I have another pro tip for you to help you bridge the gap between physical therapy and home fitness. A lot of times people have back problems. I mean, that's a common problem. Herniated discs, rotated type of pelvis, upslip. That's why you have one leg higher than the other. So a lot of these are very common things and people look for them so that they're treated. Sometimes there's actually something that's undiagnosed, and that's a compressed SI joint. And often when you go to take a step, and actually when you just go to get up and stand for a little while, you have pain right here. That's the SI joint. And often that kind of a symptom is that it's compressed. Let me show you an anatomy book so that we're all on the same page. Okay. This is the spine, and what you have at the end of the spine, because everybody's familiar with the vertebrae, you know, with the discs in between, but then at the end of L5, you actually have, sometimes when you hear L5S1, that's down in this area, because this is called the sacrum, this kind of wedge-shaped looking bone. And then attached to the sacrum is what some people refer to as the tailbone, or it's formerly called the coccyx. Now, on either side of the sacrum, you have like these ear-shaped bones. They're your hip bones, and they're called the ilium. They form a joint between the sacrum and the ilium, and that's the SI joint right there. You have one on each side. Now, what happens sometimes, I talked about what's a very common type of a problem that is easily diagnosed, and people look for it. When I say people, I mean doctors, physical therapists. The ilium often will rotate forward or backward, and sometimes it upslips. And, you know, these are common things, and that's what gives you sometimes one leg is longer than the other. But what goes sometimes undiagnosed is when the SI joint gets jammed together for some reason. And that's what I want to focus in on today, to decompress that area, all right, to open up those spaces, and that will help to give some of the pain relief that we talked about with some of those symptoms. Okay, so in order to do that, I need to lay down. Say the painful spot is the right low back. Take your left leg, which is your opposite leg, straighten that out. Bend the leg that is the painful side. And what you want to do, it's like if you can think of like a bridge when you lift your back up, but you want to lift up and over. So up and over. Up and over. It's like you're rolling your hip to the opposite side. All right? Now, if the other side were the painful area, this is how it would look. But what you're trying to do by that lifting up and rolling, if you remember the picture I just showed you, you're trying to decompress that area that's compressed, that hip bone against that wedge-shaped sacrum. So you're trying to open it up and decompress it. Now, another way of doing it, you take a yoga block, you can take a pillow, you can take a ball. But a yoga block is nice because you can use different sides of it. Now, what I would say to get started with, depending on if you're in severe pain, start with your legs straight and start with the skinny portion of the block. Put it between your legs, and you're going to squeeze inward. And you try to hold that for about 3 seconds and release. Hold it and release. Now what you can do is you can turn it this direction. Same thing. Squeeze and release. Squeeze and release. And if you want to take and advance that a little further, take it to the widest portion of the block. Keep your legs straight and you're squeezing. All right, now, if you can, bend both knees. The alternative to that, if you didn't want to keep your legs straight, same thing, but your knees are bent. Put the block in between the skinny portion if you're in severe pain. If you can go a little wider, open it up to the bigger portion. And then really what you're looking for is, if you can, to tolerate the biggest portion of the block, and you're squeezing. What you're trying to do is get your knees, actually, sometimes it's not even just squeezing, it's that you're trying to bring your knees together. So again, you're trying to decompress that joint. You're trying to, if it's jammed up like this, you're trying to open it up. Okay. Now there's another way that I want to show you. Start with your knees together, and your feet in the back go out. So I'm going to actually turn around. Your knees are together, but the feet go out, and your hands are down underneath your shoulder, and you're going to rock back and forth. From the front, it looks like this. And your knees are together, but your legs are out. And you're rocking back. And that movement helps to open it up. All right, now, there's one more movement that I have for you. Take a chair. All right. Now, I'll say the painful area is on the right side. Put the right leg up, and you're, with both hands, you're reaching down. Okay. And so sometimes it may be a combination of all of those movements that I just showed you. Sometimes it's just one of those that will help decompress that SI joint up enough that it will help give you the relief that you're looking for. Sometimes it takes a little bit, because just as easy as sometimes it is to decompress the area, it can actually be that easy to bring it back in. Because what really has caused some of that is when, see how I'm sitting on, like this? That's actually not good. You need to sit balanced. Whenever, like, you sit or you stand kind of like that, that's going to throw things off. And like I said, it's common to have the rotational movements of the SI joint, but just as common as those things are, it can be compressed too much, and you need to open it up, and that decompression will give you the pain relief that you're looking for. So I will, at another series, do some of them to show you exercises to correct the rotational ones, but it's not as common to the treatment for decompressing that area. So that's why I wanted to start with something that's not as common, that if you haven't been given that kind of instruction, give this a try. It may be just what you need. Again, this is about bridging the gap between physical therapy and home fitness. It's about staying as healthy as you can. There's more pro tips to come, so stay tuned and have a great day, everybody.